patiently, quietly, gently, calculatively. Hey! Oh no! He just sit down. This na man, where because of him, many people nearly die because of jealousy and envy. Oga of Naptip, waiting consume her. The former DG Naptip, waiting consume that woman. Now this Dr. Otabor's case. They go gang up with Naptip to destroy Dr. Otabor and Alliance Hospital. For all the good things where this man they do. From January to date, treatment, free treatment where Alliance Hospital don't do for Brekete family members where we don't know where they come out from. To date, the last time where I checked, surgery alone don't reach over 80 million naira. He get patient where I carry go Alliance Hospital. 3 surgeries, major surgeries. The man, a Yoruba man from Yoruba land, he carry intestine for more than 4 years. They waka. If he dey poo-poo, you go dey see poo-poo for inside leather. For the whole Yoruba land, nobody help him until he come here. This man, I carry and go Alliance Hospital. Special ward, private ward, everything. First class treatment, VIP treatment. This man do finish. He can't they misbehave for the hospital. Me, I go meet Dr. Otabor. I say, discharge him, make you go. Dr. Otabor talk, say no. I say, this man, they insult you, they insult your staff. For waiting you, they do, waiting the whole Yoruba nation, no do for him. I say, pursue him. He say, if I pursue this man at this stage, if he die. I say, pursue him. He say, ordinary president. As I start, God will give me the grace to complete him. Now this same man, you think say if you plan evil against, you go succeed? Other of in colleagues where they do kidney transplant, very expensive for Nigeria, most especially for Abuja. They hear say in hospital don't start kidney transplant, and he crashed the price. They begin set up. They begin plan. They begin. God don't disgrace them one by one. And you know, the thing where they worry me about Dr. Otabor, of all this turbulence, of all this kamugu kriyama kwa kwa kwa, the thing no shake am. The thing no shake am. When I come meet Dr. Otabor, Dr. Otabor, he's an ordinary president. I say, Doctor, do you expect me to be worried? My conscience is clear. I have not done what they are accusing me of doing. I know if God exists, God will exonerate me. So I have handed over my matter to my Creator. Ah! Dr. Otabor, are you not worried? He said, why should I be worried when God is fighting my battle for me? Now, so one day, they sack the DG Naptip. They invite this man, he go by himself. This woman say, make them detain him. They not get court order to detain him. He there. They process court order just to detain him because they want to please their paymasters. May God scatter them one by one. Ladies and gentlemen, I hand over the microphone to Dr. Otabor. Anytime when you come here, knowledge must follow us go. Make we crap now. No. This crap is not good though. If you say na me be Dr. Otabor, I don't go talk.
Thank you, Ordinary President. Good morning. Good morning, Ordinary President. Good morning, Brekete family members. Thank you so much, Honorary President. The fierce battle that I've been going through for the past 1 year, if not because Honorary President saw the truth and decided to stand by me, it would have been different. I thank God for using him to give me a voice. And part of the reason why they were angry with me was because I came to this place to speak about the truth. Yes. Honorary President, I want to tell you that one of the civil cases they brought against me, they said I should pay them 500 million naira. That case has been dismissed. Yes. So there are 3 other cases that are still pending. I know the way this one was dismissed, every other one will follow.
God.
Yes. And when everything is done, I will come here to say a special thank you. I would use the opportunity to chronicle everything for the whole world to hear and to know what has been happening.
Thank you.
Thank you so much, Honorary President. So this morning, I wanted to talk to us about something else. I wanted to talk to us about how to handle common emergencies that can save lives in the house, or maybe when we go for parties. But by 3 a.m., I received a call from the hospital that a woman who had a stroke just passed on, 60 years old. And day before yesterday was World Stroke Day. So I know that we have talked about stroke before, but this is another opportunity to talk about it, because people are dying needlessly. 80% of stroke can be prevented. And so today I want to talk about stroke.
Okay, before you talk about stroke,
yes, sir.
Make I strike you small. Abubakar Sadiq Okene, the Brekete Family ambassador in the whole of Kano State. He says, see how this man look cool and beautiful today. Wallahi, I know women go the Russian. But I thank God, say, you know, go get their time. Hey! So continue, sir.
Thank you, sir, Honorary President. Okay, so I want to define stroke. Stroke is sudden dysfunction of the brain as a result of shortage of blood supply to that part of the brain. You know, the brain has plenty blood vessels through which nutrients and oxygen supplies the brain. And so it is very dependent on oxygen and on nutrients to be able to do its function. I know every part of the body is controlled by the brain. Once there's something wrong with one part of the brain, it will manifest in the body. So when the blood supply is not getting to some part of the brain, then you now begin to see the manifestation of that in the body. And what are the manifestations? It can be half of the body is paralyzed. You know, when the right side of the brain is diseased, it will show on the left side of the body. Yes. If you see someone who cannot carry his right or his left hand, just know that the right part of the brain is what is abnormal. Yes. So it can also show in form of deformity of the face. The face can be dragging to one side, or some people may not be able to see, or they may not be able to talk. It depends, depending on what part of the brain is affected. And to a very large extent, many people don't even survive stroke, depending on how massive it is. Yeah, you hear sometimes people sleep and they don't wake up. It could be that they suffered a very massive stroke, a big blood vessel ruptured in the brain, and they just die on the spot. For some, you hear that someone was talking and he suddenly collapsed, and they rushed him to the hospital and he's dead. That could be as a result of either a stroke or a heart attack. And whether it is stroke or heart attack, it is an attack. So when I'm talking about how it happens, you will understand that stroke is like brain attack, while the other one is heart attack. They are similar because they occur from similar events. So What is the epidemic? What is the incidence rate? How common is this? It's very common. All over the world, according to the World Health Organization, 15 million people suffer stroke every year. And that means before the end of this presentation, or let's say before the end of today, 40,000 people would have had stroke. Yes, 40,000 people all around the world. And before the end of this presentation, about 800 people may have had stroke in 1 hour. Is that common? And if you come to hospitals, especially, tertiary centers like ours, you see that sometimes we admit 3 people a day from stroke. Yes, and many of them survive, but after survival, the quality of life may not be very good, because once one side of the body is weak, or the person cannot talk, he can't even feed himself. If he's the breadwinner of the family, that family is already in trouble. Yes, and the age that is at risk. Before, it used to be mainly people of middle age, like 50 and 60 and above. But now we are beginning to see that even young people are beginning to have stroke. The other day, I received a patient of 34 years old. He had a stroke. And the type of stroke is usually very severe ones. Okay, so anything from 35 years and above, the risk of stroke is high, is beginning to rise. But the peak age incidence for stroke is for anything from 55 years. Just imagine when someone has finished training his children in the university and is just planning to come and relax and enjoy the fruit of his labor, and then suddenly there's a thunderbolt. He just wakes up one day, can't lift his right hand or his left leg, or he's talking to his wife. His wife is talking to him, he cannot answer, or he is blind on one eye. Some people cannot control their urine, or so many things can happen. And I know that almost everybody here would have seen one person or the other that had a stroke, or a relative. Don't think that it's far away. It can be very near, except we do some of the things that I'm going to be talking to us about today. So, what are the classification? What are the different types of stroke? There are 2 major types of stroke. We have the ischemic stroke. I will explain it. Ischemic stroke and the hemorrhagic stroke. Now, when the blood is flowing in the brain, it doesn't just shower everywhere. It's flowing in the blood vessels like water going through pipe. And then that flow, it's controlled. No solid is inside. Everything is liquid. But if for any reason blood clot form within the blood vessel, that blood clot will go and block the vessel. And when it blocks the vessel, anything beyond that point, blood will not get to it again. And then that leads to a stroke. We call that ischemic stroke. But hemorrhagic stroke is when the blood vessel bursts. Yes. And if the blood vessel is under high tension, it can burst. So it's just like you have pipe. If you have burst pipe, you can be sure that after that point of burst, there will not be water flowing again. So that's what leads to the dysfunction that we have. The reason I'm explaining these 2 different types of stroke is because it has implication. If one has a blood vessel that is blocked, maybe with blood clots, it can easily be treated if it gets to the hospital on time. Stroke is time. Brain is time. I find out that many patients that come to our hospital after they have stroke, many of them come the next day or maybe 2 days after. In that circumstance, there's not much that can be done to reverse the ones that can be reversible. And it's also good for hospitals to know if you see that this is a stroke case and you don't have what it takes to manage the stroke, especially that emergency period, don't keep the patient. Send the patient to, if it's National Hospital where they have a CT scan, Honorary President, you remember that you came to commission our CT scan last year. That machine is very important when you are evaluating a patient with stroke. When the man suddenly have complain of that weakness and all that, within 30 minutes the patient should be in the hospital, and in another 30 minutes he should have done the CT scan. If he does the CT scan, the doctor can know whether it is a blocked vessel or whether it's a ruptured vessel. If it is a blocked vessel, there are some medicine that you can give the patient. By evening time, the man is getting up and he's going home.
You don't melt the...
Yes. But if nothing is done to that blood clot and it stays over 5 hours, then there's nothing that can be done.
Where did they rush stroke patients to native doctor? Na do then do baba, na do then do mama, na kill una de kill baba and mama. Na hospital una suppose go. And hospitals now, una we be hospital, we no get the capacity to handle this kind of emergency. Dr. Otabor don't advise, say, send the person, refer the person immediately, no delay. Make them go where CT scan machine they, where expert, we go translate waiting CT scan machine. Don't give to understand whether na ruptured,
whether na blood clot or na burst vessel.
To continue, sir.
Thank you, Honorary President. So what are the causes of stroke? What we talk in terms of risk factors.
Lawyer Michael said, exactly, sir. This is what killed my madam. She was just buried last Saturday.
Wow. See.
So, continue,
quite
sorry.
Unfortunate. So what are the risk factors for stroke? The number one risk factor in this country and in this environment and in Africa is high blood pressure that is not controlled. Majority of Nigerians will have high blood pressure as we get older. Yes, but high blood pressure in itself is not too much of a problem if we do what we are supposed to do. Because as we get older, our blood vessels become thickened and become less pliable. So we are bound to have high blood pressure, especially if there's a family history. If anybody is told that he has high blood pressure and the person goes for 2 months, 3 months without knowing what his blood pressure is, that is an irresponsible man. A stroke might just be waiting to happen.
Waiting be the number one sign of stroke.
Number one sign, you see, is a sudden loss of some part of the body, function of part of the body. And many times it doesn't give you signal. You just wake up and discover that half of your body cannot move. You wake up and you discover that your mouth is moving to one side. You wake up, you discover that you cannot control saliva. Sometimes the man cannot talk. Other times he might just be blind on one eye. These are some of the symptoms of. Sometimes there's urinary incontinence. He can't hold his urine, and majority of time it's not reversible. But in some cases, with good treatment, you can reverse it. But because of the late presentation in this environment, many times the person has lost his job. They will sack him from work. He will go home, become a burden, and maybe he's 45 or 50 when this happens. Until he gets to 70, you can imagine the quality of life. So that's why if you can prevent it. And the good news is that in 80% of the time, we can prevent it. So that should be good news. So when you have high blood pressure, if you don't know whether you have high blood pressure, from the age of 30, you should be checking at least once a year to know whether you have high blood pressure or not.
Sorry for interrupting you. Please forgive me, doctor.
Yes.
Ray Ramils Khalid, he said my dad was in the hospital. They didn't have a CT scan machine, no MRI machine. We were referred to youth, but they were on strike. Another clinic that had the machine said their machine was faulty.
So you see the problem with our country, because we're a developing country. There's scarcity of infrastructure for healthcare. And I mean, imagine a place like Jos. If you have only 2 or 3 CT scans, it's not enough. We should have 20 CT scans in Jos. And we should have 50 CT scan in Abuja, but in Abuja, at per time, the number of CT scan that is working is probably not more than 4. Yes, so yes. So that's a problem. And then cost is another thing, because CT scan is expensive. Not everybody can pay from their pocket. And that's why health insurance is also important. So that when people face things like this, they don't have to think of where to get the money. Some people will have to have family meeting first before they can get 80,000 naira to do CT scan. So these are issues these are public health issues that our health managers, should be able to address with time. But it's also good to know what is the standard thing to do when one finds himself in that situation.
Can exercise help somebody prevent?
Yes, very well. I'm coming to the prevention.
Okay, sorry, sir. Sorry.
Thank you, Honorary President. So I said hypertension. Know your blood pressure at any given time. And if it is higher than normal, start raising alarm. Go and seek for help. If you don't have money to buy your medicine, it's better you go and ask person for help to buy the medicine than when you have a stroke and then you are going to become a burden to everybody. So take your medicine if you need to take it. Normal blood pressure is 120 over 80 millimeters of mercury. For depending on the age, 130 over 90 is still acceptable. But anything above 140 for the upper one or 90 for the lower is high blood pressure. And if it stays there for a long time, it will affect the blood vessel. And then under pressure, the vessel can burst. If it bursts in the brain, it leads to stroke. If it bursts in the heart, it can lead to heart attack. If it blocks in the brain, there are other things that can cause the vessel to block. If it block in the brain, stroke. If it block in the heart attack. The second commonest cause for stroke in this environment is diabetes. Diabetes that is not controlled. I always put the word controlled because diabetes affects all the blood vessels in the body, even the eye. One of the commonest causes of blindness in this environment is uncontrolled diabetes. One of the reasons why we do amputation, I'm an orthopedic surgeon. I do amputation a lot of the time. One of the reasons why we do amputation, you would think that, it's accident. Accident does not even cause as much amputation as diabetes. Yes. Diabetes that is not well controlled. Because if the blood sugar is too high in the blood, over time, it begins to change the structure of the blood vessel and then begin to block it gradually until it completely blocks it. If it blocks it high up above the knee, from that point down, you find that patients can begin to have rotting leg. There are sores on the leg, so many things. And eventually, when it gets to a critical point, once the leg becomes gangrenous, you don't have a choice but to amputate. And you have to amputate above the level of the blockade. Yes, otherwise you will keep amputating. Some patients have decay, the gangrene of the foot. And we advise them that, look, this amputation should be above the knee or below the knee. They say, no, just remove where is gangrenous. But we have already seen it that the problem is above that level. If we do it where you want, you will come back again to do it because the wound will not heal until you get to the level of good blood supply. So diabetes is one of the causes because it changes the nature of the blood vessel. It reduces the caliber of the blood vessel. And when it blocks the blood vessel, then at that point, a stroke can emanate from there. There are other causes of stroke, obesity or predisposing factor. When people are on the big side and yet they are also sedentary, they don't move, just sit down in one place. There are some business people, once they resume in their shop, they sit down from morning till night. They are giving instructions. They are telling their boys to be doing everything, and yet they sit in one place. Yes, for hours. That is risky because when you are not moving, your circulatory system is stagnated. Blood clot can easily form in the leg, and if that blood clot moves to the brain, it can lead to stroke. Then our diet too. If we don't eat well, if we don't eat good food, or recommended food, it can lead to stroke. So I have said this here before, and I want to repeat it again. Some people, they say when they were small, they really suffered. Now that they have made money in their middle age, they want to enjoy. And their own idea of enjoyment is the food. They want to eat one full chicken at a sitting. You are risking your life. Don't allow your wealth to be don't allow your food to be a measure of your wealth. Eat balanced diet, not necessarily what you missed as a child, because you are what you eat. So
some people, they chop 7 eggs.
Very bad. So there's a rule of thumb I advise people. If you have a bowl of food, divide it into 2. 1/2 should be vegetables. By vegetable, I mean all your cucumber, carrots, lettuce, what have you. That will be 1/2. Then the other half, you divide that other half into 2. One side now would be protein, maybe your fish, your meat, whatever. Then the other half will now be carbohydrate. So that means 1/4 of your plate will be the carbohydrate. The other 1/4 will be the protein. Then the remaining half will be vegetables.
Okay, like roasted corn now. How many vegetables you get inside?
Well, roasted corn is protein. Yes, but corn is carbohydrate. Yes, so if you have corn, you put it on one side. But sometimes corn also contains cellulose. It contains roughage. It's good. But generally, if you have, let's say you want to eat yam, divide the plate into 4. The yam should be one part. Then if you have fish, it should be in the other 1/4. The remaining half should be the vegetable, your soup and all those things. So it helps to because those vegetables, they provide antioxidants, they provide the micronutrients that you need, and so on and so forth. So compare this to just say, give me chicken, and then you finish one chicken at a go. If you continue that for months and years, then you are going to be at a very high risk. Or if it is just pounded yam, heap of pounded yam, and you just level it with maybe very little other things. That's too much carbohydrates. That also has its own problem. Then another reason, some other disease conditions of the heart. The heart, if anybody, see, as we get older, things change in our bodies, especially our heart. If anybody has a heart problem, like atrial fibrillation and hypertension or any other heart disease, the person is at risk of having a stroke. Yes, in atrial fibrillation, the heart is beating very fast and irregularly. It can throw up blood clots. And that blood clot, the body circulation is just going on every time. As we are here now, the blood is circulating everywhere. And if there's any risk factor that makes the blood clot, it just goes to the brain and block the brain, and then that is stroke. So then sickle cell disease, people with sickle cell, I've seen 12 years old who had a stroke because the blood is abnormal. Yes, so these are some of there are quite a lot more of the factors that predispose to stroke, but I just mentioned even pregnancy, anything that can cause the blood to change in consistency, pregnancy hormones, the use of some steroids, they can all lead to stroke.
Doctor, I beg, no vex. I want to change your location.
Okay, sir.
I beg. Yeah. No vex, sir.
Okay, sir. Thank you.
The way I know they argue, if you tell me to...
Honorable President, you are in charge.
Not today. If I go there, I'm not in charge. Make we appreciate this doctor now.
Thank you. So I've talked about clinical features before. A lot of people still say, I hear about stroke. How do I know that it is stroke? I've explained it. It might be an eyewitness. You may be the one who is the close relative that has it, or you may meet the person in that situation. So, and it can happen at any time. In fact, airport aircraft pilots have suffered stroke behind the cockpit before. Yes, and it comes sudden. That's why it's a stroke. That's the word stroke. It is usually sudden. You just noticed it that, wow, what's happening?
From the word strike.
Yes, exactly. Most people will have headache, one sharp headache, and then suddenly they want to turn as before. They can't. They realize that this hand can't go up again. It can't even move. Sometimes they can't even feel anything on that part of the body. And then sometimes they can't control their urine. And, sometimes it can affect their breathing. Some people cannot talk. Some people, when they have stroke and it affects the speech center, they cannot talk ever again in their lives. So they may be using sign language and all that. So there are different symptoms that can happen when one has a stroke, depending on the location of the problem in the brain.
So what will be the difference between that type of stroke and temporary ameba stroke?
Okay, transient ischemic attack.
That one where you lie down, you just middle of the night to raise your hand. I don't know whether when I don't experience more. To raise your hand, you be like say blood. Either you sleep once. You don't do una before. When I no go, follow me. Ask the question. Tell him I beg. Yes. Tell him I beg. When I no go beg him now, doctor no answer.
Thank you, Honorary President. That one you are talking about is called apnea. There's a temporary cessation of breathing, and because of that, when you are suffocating because of accumulation of carbon dioxide, your body, you start struggling because your oxygen level is low now.
No, sir.
Yes.
This one be say, you dey breathe, oh.
Yes.
You dey alive, oh.
Yes.
You want turn. It can't be like say your hand no dey your body again.
Yes.
And you are breathing. It never happen to any. It dey happen to me, now I make.
Okay. You go touch your hand, it go be like say a big pass the
Thank
normal
you.
size. It go
You don't do una
thick,
before.
heavy, you no go
You don't do
razor.
una before.
Then you go now
quiet.
relax yourself.
Then you go
Then the thing go they come. As they come, that go be like say pin, something like the blood they flow. You go notice say the blood don't they.
Now be a boy.
There are two different things that we are talking about. The first one is sometimes when you are sleeping, you struggle to wake up as if you were under some form of, under attack, as if you are being pressed. That one is the apnea. But this one that he talked about, where one part of the body appears to be heavy and numb.
Even
it
to
will be
raise,
numb.
yes, numb.
Yes, that one is because of the way we sleep. There's the nerve that comes from the neck into the hands. We call it the brachial plexus. So yes, there's a way you sleep and you press that nerve. Then the blood supply to those nerves are affected.
Ordinary.
So you not.
They open before this thing go fall.
Okay, so thank you very much.
Yes, so that is it's because of the pressure on the nerve and the blood supply to that hand. That's what causes it. If you tie that instrument to measure blood pressure, if you keep it and press it for a long time, you will still have that symptom. Yeah. The reason is because the blood supply below that point has been cut off. So if next time they are taking your blood pressure, observe it. If they press it above the normal blood pressure, it will cut off blood supply to that hand. And if it stays there for like 2-3 minutes, you will feel as if the hand is not your own. Yes, it's because of the cut of blood supply to that area. But that one is not coming from the brain. Okay. It's a local loss of blood supply and nerve function. So what is the treatment for stroke? Like I said, brain is time and time is brain. If you are going to recover from stroke, the earlier the intervention, the better. Yes, if you can get to the hospital, not just any hospital, a hospital that knows what they are doing. Yes, preferably a teaching hospital that have a neurologist or cardiologist, and they also have facilities for CT scan, or a big private hospital that have this specialist. So if you get there and they are able to differentiate, first of all, they need to make a diagnosis. Even a baby doctor that was born today knows what a stroke is. But knowing what is the type of stroke is important. That's where the CT scan comes in. This one is not, if you have a patient, I want to educate the public. If you have a patient and you know that daddy or mommy has suffered a stroke, and you did the CT scan, and they tell you come back in 2 days to collect the reports, that is bad practice. You are going to tell them that no, that you are insisting that a specialist must see that CT scan now. Because if you come back after 3 days to see the report, what use? Yeah, because sometimes because of pressure of work, you may not get your CT scan report immediately. But you must, somebody should see it and know what it is, even before the official report comes out.
Mariam Al-Hassan Muhammad, he said, this is exactly what happened to my mom. The hospital wasted our time, and that is the reason why her hand, my mom, that's exactly what happened to my mom. The hospital wasted our time, and that is the reason why her hand is not working up till now.
Well, you know that there are some that nobody can do anything about. I said there's ischemic stroke, but there's hemorrhagic one. The one that the blood vessel ruptured, that one, you can't really do much about it. So, but the one that you can do something about it, let's do something. That's what I'm saying. Yeah, but you can't tell except we go back to the CT scan to look.
And now the CT scan now, they say may then come back in 2 days' time.
Okay.
So we don't know whether now the ruptured vessel are being the blood cloth.
So I think I believe that point is made.
Yes, sir.
Okay. So in terms of treatment, when we're treating stroke, we are not just treating the symptoms that we are seeing. We're also looking out for the reason why the person had the stroke. Because if you don't treat that reason, the person will have another stroke. And a second stroke is usually deadly. Because if somebody has a stroke once, it's like an aircraft that has 2 engines and he has lost one. An experienced pilot can still maneuver and glide and still land the plane. But just imagine you remember the Hudson River miracle,
yes,
that pilot that lost 2 engines, but by miracle he landed the planes in the Hudson River in New York. But it doesn't happen all the time. So if you lose one engine, or if you have a stroke at first, we must do everything possible not to have a re-stroke. That's another stroke.
So that's make that first engine.
Yes.
Pafuka.
Yes.
Una go trace them.
We must trace it.
Una go make sure say una block them.
Yes.
You know go affect the second
engine. If it is uncontrolled diabetes, the person henceforth now must follow his medication, check his blood sugar every morning to make sure that it doesn't go above the recommended range. If it goes above, he should start raising alarm. If it is blood pressure that caused it, he must continue to take his medication, check his blood pressure every day to be sure that it does not go higher than normal. If it is too much blood, some people have stroke because they have too much blood. Yes. Yes. Polycythemia. The normal blood range for women is 35 to around 45. The normal blood range for men is around 38 to 52. Some lab will say 54. If a man has packed cell volume of 60, he's in problem. He should go and donate blood. Yes, and it happens, especially in people who live in high lands, because the higher you go, the less oxygen, and then your body would be stimulated to produce more blood.
Hey, when I don't hear that now.
Yes.
So people where they live on mountain.
Yes. They tend to have higher blood level.
Compared to people where they for valley.
Yes. So if your blood level is too high, 50 something, maybe above 55, you are advised to donate blood. But if it is, there are some diseases that are, it's a disease, we know it. We call it polycythemia rubra vera. It's a recognized disease. Those people, we bleed them, even if they are not donating, we have to bleed them every maybe every 3 months to ensure that their blood level comes down.
Yeah.
Because if it is too much, it can lead to a stroke. If it is sickle cell disease, ensure that there's no crisis, ensure that you take your routine medication, and so on and so forth. So all those factors. Then if it is obesity, then the person will have to go on diet to ensure that he reduces his weight and all that. If the person is not active, we have to find a way of making the person active. You know, exercise is so important to prolong lifespan, and it can also help to prevent stroke. We don't have the habit of exercise in this country, but you go abroad, you see 75-year-old man jogging in the morning, you know, as if his life depends on it.
Hey, that old man, no, they look for waiting you go chop. But our old men here, they
no,
look...
but even our rich men here that are okay financially, they don't have the habit of exercise. And exercise can prolong life by 10 years on the average. Yes. Someone that is exercising regularly and another that is not exercising. Every other thing being equal, the one that is exercising for over a period of 40 years will have an advantage of 10 years longer lifespan. So what is the average exercise recommended? 2 hours a week. It can
collectively.
It can be 40 minutes, it can be 30 minutes every other day. If you can do 30 minutes every day, is fine. But 2 hours a week, and aerobic exercise. That exercise that will make you to breathe faster, you know, and your blood and your pulse rate, you know, go higher. So that is so important. Even if it is walking around for those senior citizens, you may not be able to jog, you know, walk fast, brisk walking around your compound 20 times in the morning. You have done it, you will sweat.
You be like say lizard won't pursue you, and you know want make the lizard touch you. Pia, pia, pia. You know what run. Make the not talk say you they fear lizard. And you know what make the lizard touch you. Now be brisk walk.
Exactly. Ordinary president, you have hit you. There's no better description than that. So brisk walking.
See, now you they walk out like this. You can't see lizard they come. Yeah?
Yes. 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 So if you do that for like 30 minutes in the morning or in the evening, sometimes if you are walking in a place, you can park your car like one kilometer away from the place, so that you trek to that place and trek back. That's already exercise. So we must find...
trekking too now exercise.
Yes, it's exercise. It helps. Because sedentary lifestyle is what is risky.
As they increase,
you are just sitting down from here, they escort you into your AC car, you sit down. From there, you just enter your home, you sit down, you are not doing anything. It's risky.
As they increase fuel price now, many people, they exercise.
Yes, that is one of the advantages. Yes. Then for people... Yeah.
Does the body recognize that as exercise?
Trekking.
That you know, I'm compelled. I'm not happy. I'm walking, trekking to office. I'm complaining. I'm not happy. Does the body recognize it as
now
exercise?
You go tell the body to recognize them. Well, unless you never suffer.
It's like touching the electric wire. If you say you are joking, if you touch the electric wire, you can't
appreciate Dr. Otabor.
You can't tell electric wire that you are not serious.
Even if you are a native doctor, if you touch electric wire, you go know.
So your body does not have a choice; it will recognize it. Then for people who are on medications, a lot of people are on medications, especially the elderly citizens. Most of us, they give us blood thinners like aspirin to be taken every day. Those are very important medications. Don't just throw it away. There's a reason why they give you, to prevent blood clots. Because once you already have a problem with your heart, the tendency for blood clot is there, and that can result in stroke. So these are some of the treatment modalities. Then we now just talk about prevention. Ordinary president, I will finish in 5 minutes.
No problem.
Okay. So there is no other disease in human being where prevention is better than cure, than as we have in stroke. Yes. See, every time, as I talk to you now, if you come to our ICU in the hospital, you will see like 2 or 3 people on ventilator. They can't breathe for themselves because sometimes the stroke can be so big, they can't breathe by themselves. We have to take over their breathing, hoping that they will recover. And the bad news is that for hemorrhagic stroke, the one where the blood vessel burst, where is that picture on the one of the CT scan of the brain? I don't know if you can
just
display.
put them anyone. If you know be we go. No.
The one that has white particle. No, not that.
Now you sabi.
Not yes, this one. So that's that white area you see there. That's blood in the brain. The black area is the normal brain. The darker area, the white area you see on the right side.
Yes, sir.
So that is bleeding into the brain. That's massive bleeding. This person is not likely to survive because the blood vessel that ruptured is a big one. So that's just, these are some of the things. And if you observe, it has pushed the midline to one side. That means that that brain is under pressure. So many times we have to operate this to try to drain, but statistically, even in the books, you can't have 50% survive this. So the best thing is to avoid it, to prevent it. So prevention is better than cure. I have talked about all the things that causes it. So if you avoid those things, then you are most likely going to stay away, especially for people that have family history. My grandmother died of stroke. She had a stroke before she died, not that she died of stroke. She died some years after she had a stroke. And my mom is hypertensive. So I am extra vigilant. This morning I've checked my blood pressure. And I'm okay, it's normal. And tomorrow morning I will check. Every day I check. Every day I exercise. Why? Because I know that there's a family history. So for people who have family history, you should be more vigilant.
And even you, we no get family history. This now because in they close to him mama. Some people now their grandmama. And nobody tell you say, so make we assume say all of us get family history so that we go dey careful. It just be like where traffic warden day for junction. The day where the traffic warden no dey, accident no dey happen. Why? Because this person where they come, they dey careful. This person they dey careful. This person they dey careful. Everybody they avoid the other person. So make we assume say history shows say our great grandpapa. Continue, sir.
Yes, and apart from even family history, when you get to a certain age of, let's say, 35 years, every year you should go for annual medical check once. So people say, oh, it's expensive. You don't have to do all the bigger things. Let them check your blood pressure. If you go to any clinic now or pharmacy, you can check your blood pressure with 200 naira. I don't know if that's of max 500 naira. If you talk to them nicely, they can even do it for you for free. You can check your blood sugar for the same amount. Then you can check your weight. Once you know your weight, you know your height, you can calculate your body mass index.
Sir, will it be a bad idea if we buy industrial scale, put for front of gate here, put this temperature, blood pressure? No, some people go carry have dead body can't drop here. We no go do. Continue. We no go do.
Okay. But anybody that wants to check their numbers, they can come to our hospital and do it for free. We do it. We check blood pressure and pulse and
no good
and
there,
weight.
No good yes.
And weight. It's okay. See, most hospitals will do it for free
May they go
because it's not a big deal. It doesn't cost anything. It's just the apparatus, and the apparatus is not expensive.
Some people go check blood finish. They go tell you say they no get transport to go back.
Okay. You understand this more than me.
And now you invite them.
Yes. Okay.
You go just I did my own. 9 Dr. Otabor announce them. Say make I come. Now I don't come. I don't get transport to go back. I know they go anywhere.
Yes. So prevention. If you are not sure it is recommended that at least once in a year, you just go to the hospital and say, how am I doing? So that they can check you. Even with 30,000 naira, you can do some important tests that can help you know that you are fine. And you do that every year.
Hospital where you dey sure say their machine they work. No be the one where go carry sample, enter one room, you put water inside blender, press. They come back, they say malaria 30%, typhoid 2%.
Yes. So lifestyle modification, what you eat, exercise, good sleep, because stress is also a predisposition to stroke. Yes, when people are stressed continually, it causes their body to produce stress hormones.
See one candidate here.
So if that continues, it can also be a predisposition to stroke. So I check out what are the social stressors, and then you can avoid them, and with that you will be fine. So these are some of the things that we can do to prevent stroke. In terms of prognosis, I've talked about it before. Prognosis means the outcome, what will happen. About 6 million people die every year from stroke.
6 million?
Yes. Out of the 15 million that suffer stroke, 6 million die every year from stroke. It's one of the commonest cause of loss of lives everywhere in the world, not only in Nigeria. So there's no the best guarantee is to do your best to ensure that it doesn't happen. But because when it happens, we can't tell to what extent it will go.
Thank you.
So then the deformity, permanent disability. A lot of people have lost their job because they can't continue to do what they used to do, and many of them are the breadwinners. They just threw the family into financial crisis. So it's not just because of you that you should check yourself. You should check yourself because of your loved ones. Thank you very much, Honorary President.
Hey. Dr. Otabor, I get one request, I beg.
Yes, sir.
The next time where you go come, whether you go help us get another medical person, we go translate what you they talk into Hausa language.
Hausa?
I beg. I beg. Oh, after the program, we go translate them to different languages. We go get people else we understand. We go do them like you go lay in voice. After you talk like this, they bring your voice down. You talk with you talk, so that Igbo, Hausa, Yoruba, Idoma, and other languages. Because you see this knowledge where you give us, 50 million naira no go give us. Many of us don't dey equipped. Thank you very much, sir.
Thank you, sir.
Yes, sir. Anybody get a question to ask Dr. Otabor? Why would they rush him like this? Oh yeah, make we start with you, Consultant Ike.
Okay, Doctor, thank you. You've been start to tell us about how brain be and how it be say stroke now for brain, and you talk say it they divided into two parts, the left side and the right side. So when you begin notice something on the right side of your body, you know say that thing not be even on the right side of the brain, or the left side of the brain. In fact, that really opened my eyes to many things. But you get one thing where they talk when we dey school. I don't know whether that not true or they make joke out of it. They say the brain they divided into two, the left and the right. Sorry, on the right side of the brain there is nothing left, and on the left side of the brain there is nothing right. I don't know whether you don't hear.
The person will talk that in he drink alcohol. Thank you. Next question.
Good morning, sir.
Good morning.
Please tell us more about sleep apnea that you mentioned. What is the cause?
They do exercise if you know they sleep.
Okay, not be
Yes.
not the sleep.
Sleep
Yeah,
apnea. Yes, this is an important question she's asking, and a lot of people suffer from sleep apnea. Sleep apnea means cessation of breathing temporarily. So sleep apnea is when you are sleeping, there are certain things that can cause your breathing to cease. For instance, if tonsils are enlarged, especially in children, the airway is not clear. Sometimes the tongue may fall back and cover the airways. So, and some neurological conditions can also result in that. So if the body is without oxygen for 2-3 minutes, go to 4 minutes, then you will wake up with restlessness because there's accumulation of carbon dioxide in your body now. You wake up, that's what causes some people to say it looks like they were under attack.
Then they press me. Then
Exactly,
they press me.
they are pressing me. It is sleep apnea that causes it. So you need to, we need to evaluate you. In fact, sometimes you have to sleep under some gadgets for us to know your sleeping pattern and then know at what point during your sleep this happens. And also the causative factors. The ENT surgeon will also look into your airways, through the nose and everything to know what is the cause. It might even be a small growth inside there that is causing it in the windpipe. So it's a big topic of its own, and it's a concern. And some people, unfortunately, have even passed away because of that, if it is not treated. So it's an important question.
Thank you, sir.
And if you know anybody with such, tell the person to come to the hospital. Sometimes we have to put CPAP. We have to, some very severe case, we have to put a machine for the person. So that when that his own breathing stops, the machine just takes over for that period.
Okay.
Thank you. I hope I answered your question.
Husseini Mohammed for YouTube, he said, Doctor, please, what can be done in terms of first aid before taking to the hospital?
Okay, first aid. Very important. Okay, so it depends on the severity of the case. Sometimes the stroke can be very massive that the person can stop breathing. If the person stops breathing, then you have to do what we call CPR, cardiopulmonary resuscitation. You have to do chest compressions and then give the kiss of life. You breathe into the nose.
Okay.
Do
mouth-to-mouth resuscitation.
Yes, mouth-to-mouth resuscitation. Do chest compressions continuously. It helps to ensure that blood gets to the brain. That's one.
Which part of the chest then go press? Left,
around
right,
around the
center?
sternum, just at the middle, around the breastbone, the lower part of the sternum. Yes, you put the heel. Actually, I would come back another day to demonstrate it. Yes. So you keep pressing that until the heart starts again. Then, if the person is drooling, or maybe some people vomit in the process of the stroke, you have to lie them down on the left lateral position. Once you are sure that their pulse rate is present, that their circulation, you lie them down on the left, not on the right. If you lie them on the right, whatever is coming can go into the lungs, because the right lung there's a way it is positioned, the right bronchus. So you lie them on the left lateral position and put their hand under their head like this until help comes. Yes. Ordinary President, you want to lie on the ground? Exactly. Put your hand. Exactly. Excellent. Ordinary President is overdue for the diploma in medicine. It's long overdue. Nothing is needed to be added. Diploma in medicine is enough now. You want me to give him MBBS? If you give him patient to do surgery, you carry a casket along with you.
Now you see that position. Wait, a doctor described with a column recovery position.
Yes.
The airways, everything is open
Yes.
like this. to continue.
If he lies back on his back, the tongue can fall back and it will block the airways. He can just die from there because he's not fully conscious. So when you put tongue to the left, the tongue will not fall back, and that would be okay.
And for those of us where they worry, ordinary, you lie down for ground. If I die now, na ground they go dig, put me inside, pour sand again, waka leave me. Now only me and my character. Thank you.
So, doctor,
Yes.
talking about surgery, I'm a surgeon too. I was just scared the way you were talking because
You are a what?
I'm a surgeon. I dey conduct surgery for chicken. And,
For chicken.
roasted
Okay.
chicken.
Okay. So it's, I'm
and,
happy you qualified it.
you scared me when you were. Why did they laugh? But not true now. They no get bone and they cut the bones and when she say what you've told me to desist from performing so much surgery on this kind of animals. So, but the issue I want to ask actually is, you go this ordinary.
Sorry, na cough I cough.
Okay. The thing I want to ask is, sometimes when you go for all these checkups and you discover that you have this kind of sickness, you go see the person no go last again. But when he no know about them, he they go about in daily duty, they enjoy.
Gentle daddy, they keep people for village.
No, I'm just
Now when
asking.
they talk, say, waiting you know you. Some things where you know, you know you well.
No, of course. That is why people go just fall die now because they don't know say they get them. We all know that. But when you can't know, when he's supposed to even help you, you go can't see some people. Yeah.
No, see, you cannot play the ostrich with your life. You know, the ostrich will bury his head in the sand
And
assume that nobody is seeing him. Yes, a stitch in time saves 9. What that means is that if your cloth is torn a little and you put 1 stitch, it will save you from 10 stitches.
9 be a stitch.
Yes.
Saves 9.
Yes, a stitch in time saves you 9 other stitches. So it's important to know what is going on with you at any time. Let me give an example. The one that is dreadful. A lot of people are afraid. They don't want to know their HIV status. They don't want to know. Meanwhile, HIV now, if you know and you treat yourself, there are people who have been doing 25, 30 years on treatment. Magic Johnson in the US, he was discovered in the 80s. And the guy is healthy throughout. He has outlived many people. But if you don't know and the disease is ravaging all the body, one day you fall down. They check, you have had kidney failure, HIV nephropathy. Do you know that it's remaining 6 months for you to live? Or the CD4 count just drops to the extent you just discover that you have 1 cancer or tuberculosis. So why don't you know now? So that if there's anything to be done, you start doing it. So you understand? So even the same thing with endoscopies. And this is why people abroad live longer, apart from the hardship that we suffer. They go for checkup and they discover things. Sorry, sir. There's this man, one colonel in the army, that came with a cancer of the colon many years ago. When I saw it, it was so pathetic. Because if he had done endoscopy 4 years before, it was just a flesh that grew out. There's a surgery we call a snare operation. It's a 30 minutes. You do it and go home that day. But he didn't do it. Turned to cancer. He didn't know until one day he couldn't pass stool again. Then it has become a big one. So we have to now do the big surgery, remove the intestine, bring it out, clear everything, do chemotherapy before we joined it back. So instead of spending 200,000 naira at that time, now he's spending 10 million. So it's always better to know so that you can take care of it than some people, they rush them into the hospital unconscious. They didn't know that they were diabetic. It was when they collapsed. That was the first time We check their blood sugar, it's unrecordable. Sometimes 30-something millimoles. And I will say, you don't know you are diabetic. Say, I didn't know. Some of them are fortunate to live. Others will just pass from there. So it's always good to know what's happening in your body.
So chicken surgeon, you don't hear the answer now. Surgeon of chicken. Now, this lady, Esther Makama, he said, I really enjoyed today's Brekete Family program. God bless you, sir, ordinary president, for your effort. Our health is very important. Thank you. Now, you get to one lady who just tell me, say, she just born. And since where she born, 4 months now, her BP high. Up till now, the BP never. Okay, patience, Emeka. Doctor, my BP went high when I was giving birth. It's been 4 months now, and it's still high. Please, will it go back to normal?
Yeah, that's pregnancy-induced hypertension. For many women, their journey of hypertension starts from there. Yes, for some, it can come down. But for most women, it will just continue to be high, or for a good number of women, let me not say for most. So she has to keep seeing her cardiologist to be bringing down the blood pressure. It is important that she brings that blood pressure down at any given time. The blood pressure will not recognize whether you are a child, whether you just gave birth, or whether you are an old man. If it gets to a certain level and it persists like that, it will cause the damage. So let her treat it. The doctor is the one that will tell her that, okay, your BP is now controlled. You are out of pregnancy-induced hypertension. But some women, from there, they just now have BP for the rest of their lives.
Thank you. Godwin James say, I beg, sir, waiting concern diabetes with cutting of leg. I lost my father to diabetes even after cutting his leg.
Yes, because diabetes is more of a vessel disease. High blood sugar affects the blood vessel, and it affects it all over the body. In the eye, it leads to blindness. There are more people that are blind from diabetes than the one that had an accident or injury. Yes. In the heart, leads to heart attack. In the headquarters, it leads to erectile dysfunction. Ordinary president, did you hear that? You know, you always pray for. You always
Why
pray
if you say anything we concern area one now?
Area one specialist.
No, because of the prayer he's always praying that people's husbands should not have
power failure on duty.
Yes, so I'm telling you some of the things that can cause power failure.
And Oman Dave,
yes,
you cannot challenge my doctor. He knows me inside out.
So you they mean well. You want productivity, make people born plenty, and because when it comes to particular,
born plenty where they go fit train well.
they go fit train well, my president.
Yes. Then the legs, the vessels of the legs, it can easily block because of diabetes, or it can become diseased. And when it becomes diseased, because it's the blood is life. Any tissue blood does not get to is no longer alive. And so if the blood vessel is blocked because of diabetes, you have to take away the leg. Otherwise, it will be rotting, and the decay can be ascending until infection can kill the person.
Now, here one thing here. Abubakar Dahiru, I have questions which is very important, and you know writer. Good.
They prepare.
Yes, sir.
Okay, thank you, Dr. Otabor, so much. Thank you for this lifestyle modification lecture we've had this morning. I have one question. But, you know, like Warriman they talk, say, if you not eat food like medicine, you go eat medicine like food. And that is a lesson for life on its own. I want to ask a question about sleeping habits. How it relates to stroke. Okay, so you sleep maybe 9 to probably 4, 5 in the morning, and all of a sudden your sleeping pattern changes. No matter how late you sleep, say 11, by 1:30 a.m. you are awake. You are awake till 5:30 a.m. and then sleep will catch you till 6:30, and it has now become a pattern. You try everything you can, but for some reason 1:30 a.m. you find yourself awake. You can't sleep till that 4:35. Is that any signal? Is there any kind of signal to either blood pressure or stroke?
Yeah, it differs. Sleep pattern differs from different people, and it also changes with age. As we get older, the amount of hours of sleep that we need reduces. Yes, so, but on the average, if you can get 5 to 6 hours of sleep in a day, irrespective of whether you had it all at once or whether you had it in broken session, it's fine. But what is more important is the fact that you get refreshment after the sleep. Some people say, though I sleep, but I don't feel refreshed. That is a problem. So, but when you are able to sleep, even if you slept siesta in the afternoon, 2 hours, you slept in the midnight, 2 hours, and then early in the morning, another 2 hours.
Totally together.
Yes. Have a total of 6 hours of sleep, you are fine.
When I see
Yes.
now, not be by force to do long 6 hours sleep.
Yeah.
Make we appreciate Dr. Otabor. Somebody say you won't come see Dr. Otabor. You go hospital now. Adizat, give me the Alliance Hospitals because if I ask doctor, he not go give me. He not go give me. Excuse me. You sure? Wait. Which number be this? Now 2 numbers. The first one complete. Who now one confused? He reached 11 digits. That is that no, they try that kind of thing with me. If I make mistake here, I want you people to be doubly sure, please. Go and consult with her. Be sure of the numbers you are. Yes. Any other person will ask question? The audience. My brothers, my sisters, if I look at and sister time, don't they give us signal to do things, signal, make we continue today, but not they go. When I remember the case where they kill soldier man, where be NDA, Tama 4. When I remember, say, the hotel manager just resumed 5 days into as he resumed as manager of the hotel. Now the 5th day where he resumed, now they kill this young man, allegedly, for the hotel. The 7th day, the hotel manager, they kill him. The relatives of the hotel manager, then they for studio. When I go hear their own side of the story. And the father of this military officer will be Tama 4. Last year for NDA, where you go come out as an officer. Now this thing happen. For those of you now, why when I reduce them to one number now? Why when I do they sure of the other number? I mean when be one mislead. The number to Alliance 1, 2, 3. The number to Alliance Hospital for those of you where they ask me. Now only 2 times I go announce this number. If you need the number after the program, go and play back the program and fast forward to where I call the number. 081. I hope now the reception number. Now the reception number. How did I know they look me that kind of eye? Now do you write them? Akramakallah. Now I give you. 081 73 48 09 another 09. Again, the phone number now 081 73 48 09 another 09. So the difference now, after 081, you go just remember 7348. Then